very great morning to everyone. Welcome sa ating show na tiyak naman na mapapasaya kayo ngayon.
At madadagdagan pa ang kaalaman nyo.
KKK nga, diba? Kasiyahan.
Kaalaman?
At konting kalokohan.
So, ano ba bang hinihintay natin? Ngayon, para sa ating morning talk show, I am Trixie M.
And I am Rhea B.
And this is
Daily Dose at your service. At sa ating bagong episode ngayon, bago tayo magsimula,
kilalanin muna natin ang ating guest for today.
wow, guest, ang dami ah.
Oo, girl, alam mo, sikat to eh.
Sino kaya yan?
Let's give it a round of applause to Mimia!
Uy!
Grabe, napakagaling talaga ng guest natin for today, no?
Ibang level talaga yung guest natin ngayon.
Hala, thank you po Miss Rhea and Miss Trixie. Thank you po.
So, kamusta naman yung buhay, Mimia, lalo na ngayong pandemic?
Okay naman po. Happy po kasi nakakasama ko sa project si Limin.
Oy, ang taray! Crush ko yun.
Kaya shock na po kayo. Kasi nasa Lazada yan.
Wow, thank you so much, Mimia, for coming with us. Now, let's introduce our other honorable guest that we will be interviewing for today.
Our remarkable doctor na mula pa sa Massachusetts. Let's all welcome Dr. Christine Cabello.
Thank you.
So, good morning po, Doc. How are you today?
Hello, Miss Trixie and Rhea. I think I'm having a good time today.
That's great since maraming nag-request nitong topic na to sa Twitter, Facebook, and even on Instagram. Let's grant their wishes.
So, our tissue topic for today will be
salivary glands. And Dr. Cabello will be assisting with us through our knowledge in the topic.
and matutuklasan natin yan sa pagbabalik.
Ready for Pasadas
11:11, let's go!
Our lowest price at 2 cards.
Thank you po.
11:11 sa Lazada. Our lowest price sa Lazada.
So, welcome back to Daily Dose.
So let's get back sa ating main tissue topic of the show ngayon, which is salivary glands.
Alam mo, Rhea, it's relevant pati ngayon. Kasi 'di ba, di natin alam what saliva could really do to us, lalo na ngayong pandemic.
You are right, Trixie, virus needs a host para mabuhay, and kaya nahahawa yung mga tao. One reason is saliva or the droplets of saliva. Kaya the government wants us to wear protection such as face mask or face shield, and that's why it is important topic to tackle about, to inform the public or to inform the people about the science of this matter.
Tama, iba talaga yung transmission ng respiratory droplets, lalo na sa health crisis natin ngayon. So, don't forget to wear your mask, guys.
So, to start, can you give us an introduction about salivary glands, Doc?
So, the salivary glands, they are exocrine glands that are located in and around the oral cavity para makasecrete ng salivary contents in our mouth.
So, bale, di lang siya nakapwesto sa iisang lugar, but around the oral cavity.
Yes, because these are different kinds of salivary glands.
So, Mimia, as our patient for today, pwede mo bang i-demonstrate ito for our audience?
Yes po. So, dito po natin mahanap yung salivary glands po natin. Dito po, at saka dito po.
Wow, ang galing! Paano nga ulit?
Hala, may bayad na po ko next time.
Ay, sorry. Wala akong pera. Kidding aside, Alright, let's continue. Yes po, Doc?
So, yung function nitong salivary glands is to keep the oral mucosa protected and lubricated. So, hindi lang siya basta nagbibigay ng laway lang.
Yes, and also, tumutulong itong salivary glands natin sa initial stages ng digestion natin in chewing and swallowing of food.
So, since dinamonstrate nga kanina ni Mimi yung tatlong parts kung saan mahahanap yung salivary glands, so does that mean na we only have 3 types of glands?
Actually, those are only major salivary glands, namely parotid, submandibular, and sublingual glands. They secrete 90% of saliva in our mouth. But also we have minor salivary glands.
Yes, and ang pagkakaalam ko, syempre nag-research ako tungkol dito. Meron tayong 600 to 1,000 na mahanap na minor salivary glands sa cavity natin, sa oral cavity natin. So, ganun sila kaliliit na secretory tissue compared sa major salivary glands.
Yes, that's right. And mahanap natin sila throughout the cavity, except in the gingiva and the anterior part of the heart.
Yes, and today, to understand further yung topic natin in a histological detail,
We will watch a special creative project by our students from Harvard to give further information about salivary glands.
ooh. So, buckle up and paki-on nga ng TV natin, Mimi, yo!
Tanan!
Good day and welcome to Harvard! So, good day everyone. We are here today in the Harvard Library. And while we are here today in the university, we will be studying about the salivary gland. So, let us first start with its structure. So, ano nga bang nilalaman ng isang salivary gland? We have, tinan, the serous cell and the mucous cell. So, wait lang, upo muna tayo. Ayan. So, sila ang secretory cells ng glands. So, ang serous cells, ito yung nagsisecrete ng proteins and glycoproteins, and mucous cells, ito yung nagsisecrete ng mucins. And there are different classifications of salivary glands based on the cells it is composed of. So, we have a serous gland, which is more mainly composed of serous cells, a mucous gland, and a mixed gland, wherein you can see both serous and mucous cells inside. So this is what the cells of the salivary glands look like under a light microscope. These are the serous cells, and they are pyramidal in shape with a broad base adjacent to the connective tissue stroma and a narrow apex abutting a central lumen. And makikita nyo, mas dark yung appearance nila. That is because they contain zymogen granules. And we have the second type of secretory cells, the mucous cells, which makikita nyo mas large siya at mas pale kumpara sa serous cells. So they are pyramidal cells na may flattened na nuclei. Kita nyo, mas flat yung nuclei niya kaysa dun sa serous cells. And another cell type besides the secretory cells, we have the myoepithelial cells. Yan. And makikita nyo, they are located in between the basal lamina and the secretory and duct cells. They have a stellate shape with numerous branching processes that are filled with contractile filaments, actin and myosin, and they wrap around the end pieces. Hence, squeeze niya yung surrounding cells. Other than these different types of cells found in the salivary glands, we also have different classes of ducts na makikita sa structure na to. So basically, parang ganito itsura niya, yan. Para siyang mga drainage system. So itong pinakamalaking duct na to, located in the interlobular connective tissue, are the excretory ducts. Itong sumunod na branch are the striated ducts. And lastly, yung directly nagde-drain from the secretory cells are the intercalated ducts. So in the histological perspective, ganito siya. Intercalated ducts are smaller in diameter than their end pieces, and they have low cuboidal cells. And ganito naman yung itsura ng striated ducts. Lined by columnar cells, kita nyo may striation siya because of their enfolded membranes. hence given its name na striated duct. And lastly, ganito naman yung sa excretory duct, which makikita nyo, they are larger in diameter and have a wider lumina than the striated duct. So to summarize, in the structure of the salivary glands, we have the secretory cells and the myoepithelial cells, and the different classes of ducts, which are intercalated, striated, and excretory ducts. And that is all for my short overview on the structure of the salivary glands.
Good morning, everyone! Most of us think that the spit inside our mouth is gross.
But did you know that saliva is actually an incredibly complex fluid that facilitates lots of necessary functions?
It lubricates our mouth, assists in digestion, moistens our food, and even defend our mouths from microorganisms.
One fascinating fact about saliva is that it kills bacteria. Ever wonder why morning breath smells bad? It's due to low levels of saliva.
Unfortunately, your body doesn't produce as much as saliva while you're sleeping. Therefore, your saliva is not able to kill bacteria in the same way it does while you're awake. So now, let us proceed to the discussion of the functions of saliva.
Number 1 is protection.
Saliva protects the oral cavity in many ways.
It keeps our mouth and teeth clean by dissolving and washing away food particles from between the teeth.
The saliva provides a washing action that flushes away non-adherent bacteria and other debris. In particular, the clearance of sugars from the mouth limits their availability to acidogenic plaque microorganisms. The mucins provide lubrication and forms a barrier against noxious stimuli, microbial toxins, and minor trauma.
The second function is buffering. Saliva is one of the biological fluids containing several compounds by which the host can control mouth hemiparasites. The bicarbonate, phosphate, and some salivary proteins provide a buffering action that helps protect the teeth from demineralization caused by bacterial acids produced during sugar metabolism.
Additionally, the metabolism of salivary proteins and peptides by bacteria produces urea and ammonia, which help to increase the pH.
For the third function, digestion.
Saliva also contributes to the digestion of food.
For example, lipase, which helps with the initial digestion of fat, and amylase that helps the digestion of starch.
The moistening and lubricative properties of saliva also allow the formation and swallowing of food bolus.
Another fascinating fact about it is that you could produce enough saliva in a year to fill 2 bathtubs. Yes, not just one, but 2 bathtubs.
Production varies considerably from person to person, but on average, most people produce 0.7 liters of saliva per day, which is enough to fill 2 medium-sized bathtubs a year.
Next function, we have taste.
Saliva functions in taste by solubilizing food substances so that they can be sensed by taste receptors located in the taste buds.
Its main role includes transport of taste substances and protection of the taste receptors.
In the initial process of taste perception, saliva acts as a solvent for taste substances. Salivary water dissolves taste substances, and the latter diffuse to the taste receptor sites. During this process, some salivary constituents chemically interact with taste substances.
For the fifth function,
Antimicrobial action.
Saliva maintains an important role in maintaining the equilibrium of the oral ecosystems, and this is essential for the dental caries control.
Saliva is able to perform antimicrobial action because it contains proteins such as lysozyme, lactoferrin, peroxidase, and secretory leukocyte protease inhibitor.
The major salivary immunoglobulin, which is a secretory immunoglobulin A or IgA, causes agglutination of specific organisms, preventing their adherence to oral tissues and forming clumps that are swallowed. Mucins, as well as specific agglutinins, also aggregate the microorganisms.
Last but not the least, the maintenance of tooth integrity.
In addition to its antimicrobial activity, saliva helps protect the teeth in a number of ways. This protective function begins immediately after tooth eruption in the oral cavity. Interaction with saliva provides a post-eruptive maturation through diffusion of ions such as calcium, phosphorus, magnesium, and fluoride, as well as other trace components into the surface enamel. This maturation increases surface hardness, decreases permeability, and has been experimentally shown to increase resistance to caries. That's all for the functions of saliva. If you want to learn more about the salivary glands, please keep on watching!
Sobrang fun talaga matuto.
Paisang showcase naman ng salivary dyan, Mimia.
Alam naman siguro ng mga audience natin kung ano itsura ng laway.
Paano pag hindi? Kaya pa ba mga watchers?
More!
But before anything else, magbabalik kami after a short break.
Pag 3 pataas, mag-bonakid preschool, 3 plus.
And welcome back to Daily Dose. So, Ria, ready ka na ba for more?
Oo naman, Trixie. I can't wait to hear more from our Harvard students.
Grabe, iba talaga pag Harvard girl.
Ay, true po yan.
Shh, manahimik na kayo. Inon na yung video. Panoorin na natin.
The major salivary glands has 3 bilateral pairs of glands, which produces the bulk of the saliva. They are extrinsic glands and it produces intermittent secretions. Let's dive into 3 major salivary glands. 1. The parotid glands. The parotid glands is the largest and the most important in terms of salivary production. It is the main source of stimulated saliva secretion. Its location is near the ear behind the ramus. Every major salivary gland has its own duct. For the parotid glands, it utilizes Stenson's duct, which open on the buccal wall at the level of maxillary second molar. Did you know that the parotid glands is rich in serocells? The amount of secretion will be 25%. The parotid glands is composed of serous acini which produces watery saliva. It is used for lubrication, swallowing, chewing, phonating, and talking. Its embryonic origin is ectoderm. Its secretory duct is single layer, very conspicuously striated columnar cells.
How about this intercalated duct?
It's a long, narrow branching made of single layer flattened cells. Sensory, its fifth nerve. In secretory, sympathetic, superior cervical ganglion, and in parasympathetic, ninth nerve, ganglion vasodilation. Lastly, its development is 4 to 6 embryonic life. Submandibular gland. The submandibular gland is predominance of serous cells with some mucous cells. So basically, the type of gland of this is mixed. Its size is like about the size of a walnut. If you are wondering what is the size of walnut or what is the walnut, here is the picture and let's compare it to submandibular gland. Its secretion is important for lubrication, swallowing, and digestion. The submandibular gland is the primary source of basal saliva secretion. Its location is beneath the tongue or below the mandible posterior part. Submandibular gland release saliva through its main duct, the Wharton's duct, which open at sublingual papilla under tongue. This glandular mass is responsible for the production of 60 to 65% of the over-salivary output. Its embryonic origin is endoderm. Its secretory ducts are the same with parotid but somewhat longer and may contain yellow pigment.
In intercalated duct,
Its intercalated ducts is much shorter but same with parotid. In secretory sympathetic, it's superior cervical ganglion, and in parasympathetic, seventh nerve, chorda tympani submaxillary ganglion. Lastly, its development within 6 weeks of embryonic life. Last but not the least, the sublingual gland. The sublingual glands is composed of mostly mucous acini and thus produces the thickest and most viscous saliva. It is the smallest among the three. The sublingual glands are almond-shaped and found under the floor of the mouth. It is located beneath the sublingual fold or floor of the mouth. It has multiple ducts that open along sublingual fold, but mainly the sublingual glands utilize Bartholin's duct. Also, several smaller ducts or duct of Rivenus open independently along the sublingual fold. Its type of gland is mucus, and the amount of secretion is only 10%. The embryonic life of this is endoderm. Its secretory duct is rare or absent. Also, its intercalated ducts. Its interstitial tissue is connective tissue septa. Its nerve supply in sensory, fifth nerve. Its secretory, sympathetic, superior cervical ganglion, and parasympathetic, seventh nerve, chorda tympani submaxillary ganglion. Lastly, its development is from 8 to 12 weeks of embryonic life.
Hi, ang galing! Ang galing talaga nila.
Talaga ba? Naintindihan mo?
Oo naman, may fun fact nga ako eh.
Sige nga, parinig mo nga sa amin.
Alam niyo ba na ang salivary glands produces the most saliva during the afternoons and the least amount of saliva during evenings? Alam niyo yon?
No po. Di po namin alam. Sorry.
Loko.
Anyway, back to the show. We will give you more after this short break. So, please stay tuned.
We're flying.
I'll never let go.
What's up, everyone? I'm Vince, and I wish you a very good day. I'm here to report the 2 of the 5 types of the minor salivary glands, which is the labial and the buccal. First off, what are minor salivary glands? Minor salivary glands are located throughout the submucosa of the oral cavity. It is composed of small groups of secretory units opening through short ducts. They arise from the oral and nasopharyngeal ectoderm. Little fun fact, during sleep, very little saliva is secreted by the major salivary glands, and majority of the saliva secreted is by the minor salivary glands. The first type of the minor salivary glands are labial glands. Labial glands are located between the mucous membrane and the orbicularis oris around the orifice of the mouth. They are circular in form and about the size of small peas. Their ducts open by minute orifices upon the mucous membrane. In the mucosal area of the lip, they are represented as mixed glands consisting of mucus, serous, and seromucous glandular cells. The second type of minor salivary glands are the buccal glands. Buccal glands are present in the inner side of the cheeks and consist of mucous tubules with serous demolins. They are responsible for the secretions of about 20% of our saliva. The intercalated ducts appear variable in length, and the interlobular ducts possess only a few cells with basal striations. For the rest of the minor salivary glands, here's Trixie to explain the rest of the types.
Hey guys, so I'm gonna continue the minor salivary glands. Hey, so the third type of minor salivary gland is the glossopalatine gland. So it is located in the region of the isthmus in the glossopalatine fold. So it can extend from the posterior extension of the sublingual gland to the gland of the soft palate. And yung type of gland niya is mucous gland. Okay, so for the fourth type of minor salivary gland is the palatine gland. So it is located in the glandular aggregates of the lamina propria of the posterolateral aspect of the hard palate, submucosa of the soft palate, and the uvula. So it forms 100 glandular aggregates. And yung type of gland niya is mucous gland. And yung excretory duct niya, they have irregular contour with large distensions through the lamina propria. Okay, so for our last minor salivary glands, we have the lingual glands. So there are various groups of lingual glands. So we have the anterior lingual glands or glands of blanding and non, and the posterior lingual glands, which can be present laterally and posteriorly to valve papillae. So for the anterior lingual gland or the glands of blanding and non, they are purely mucous in nature and they can be located in the apex of the tongue. So ducts open on the ventral surface of the tongue near the lingual frenulum. And for the posterior lingual glands, we have tonsillar and the von Ebner's glands. So for the tonsillar, they are purely mucous gland and their ducts open at the dorsal surface of the tongue. While the von Ebner's glands, they are purely serous glands and they can be located below the valve papillae and their ducts open through circumvalve papillae and rudimentary valve papillae on the sides of the tongue. So that's it for minor salivary glands.
Hi Trixie! Grabe na talaga. Gising pa ba kayo? Ang ganda pa naman ng waterfalls ngayon. Waterfalls.
Special thanks to our students from Harvard. Grabe, napakagagaling.
Sige nga, gaano kagaling.
Secret!
Let's give them a round of applause. We've learned a lot today about salivary glands. We would like to thank everyone, especially Dr. Tobbs, Mimia, and our special presenters for joining us today.
It's been a pleasure to meet and learn from all of you. Pero hindi pa tayo nagtatapos dyan. Dahil sa ating pagbabalik, matutunghayan natin ang kakaibang storya from our senders.
Tama, so huwag kayong aalis, guys.
Para sa panibagong haantig-antig na storya.
Ngayong gabi, ating tunghayan ng isang kabanata ng buhay ng may Sjogren's syndrome. Samahan niyo kaming subaybayan at umiyak sa isang makabagbag damdamin na kwento ni Pasita. Dear Charot,
Ako nga pala si Pasita, 24, empleyado, kagaya nyo. Pumapasok sa opisina, kumakain din, kagaya nyo. Hindi kalakihan ang sweldo ko. Lagi napapagalitan, pero ayos lang yun.
Oh, ganun pa muna. Pagalitan ka na naman.
Oo nga eh. Salamat dito ah.
Sabi nga pala.
Aliana nga pala. I mean, pasita. Pasita.
Sige. Dito muna ako ah. Baka pagalitan din ako eh. Nice meeting with Isita.
At doon nagbago ang buhay ko. Lagi na kami lumalabas ni Cardo pagkatapos ng shift. Nag-aaway pero nagbabati rin agad. Ngunit may hindi siya alam tungkol sa akin. Cardo! May sasabihin ako sa'yo. Pwede ba kita makausap?
Gusto mo ng tubig?
Hindi yan. Seryoso ako.
Ano yan?
Mamahalin mo pa rin ako kahit minsan.
Ano sinasabi mo?
Shogun syndrome ako. Kasi may dry cough ako. Lagi akong may fatigue. Lagi masakit yung katawan ko. Mahalin mo pa rin ako.
Akong pakialam. Kahit ano pa man yan. Ikaw pa rin gusto mo kasama habang buhay. Alagaan ka, suportahan ka, tigit sa lahat, hindi ka iiwan.
After ng 3 taon, nagpakasal din kami ni Cardo. Hay, sa wakas, akala ko di na niya hihingi ng kamay ko. Ngayon, nagsasama na kami sa isang bahay. Pinatigil nga ako sa pagtatrabaho dahil sa kondisyon ko. Carlo, tubig please.
Ano ba naman yan? Pagod ako.
Carlo, tulong. Sakit ng kamay ko. Nahihilo ako.
Tulog yung tao. Ni-istorbo mo. Tigilan mo nga ako. Alam mo, pagod na ako sa'yo. Pwede ba mag-iwalayan tayo? Nakakabisit ka na eh. Hindi na kita kaya. Patawad. Paalam.
Anong naramdaman mo nun, Pasita?
Masakit. Kasi yung taong nangako sa'yo, umalis din. Pero tumayo ako sa sarili kong paa. Heto na ako ngayon. May sarili kong pala.
Doc, ano po ba yung Sjogren's syndrome?
Oh, hi there. I heard you're asking about Sjogren's syndrome. Why don't you come with me? And I'll explain it to you. Let's go. Sjogren's syndrome. Sjogren's syndrome, it occurs when white blood cells target healthy cells in moisture-producing glands such as salivary, sweat, and oil glands. So this condition most commonly affects women with autoimmune disorder. For example, lupus. There are 2 forms of Sjogren's syndrome. The first one is primary Sjogren's syndrome. It develops on its own, not because of any other health condition. Second one is the secondary Sjogren's syndrome. It develops in addition to other autoimmune diseases like rheumatoid arthritis, lupus, and psoriatic arthritis. So there are several factors that causes Jorgen's syndrome. First one, we have environmental factor, genetic factor, sex hormones that most commonly found with women rather than men, and viral infections. So these are the signs and symptoms of Jorgen's syndrome. First one, we have abnormal in sense of taste, dry cough or hoarseness, dry itchy skin, fatigue, and for women, vaginal dryness. So how can we know if a person has Jorgen's syndrome? So there are several tests that we can use to diagnose a person. First one, we can take up their health history, run some blood and urine tests, biopsy of the lids, eye exam, imaging tests, specifically ultrasonography of the major salivary gland. So as of now, the Jorgen's syndrome has no cure, but there are several management to treat the effect of Jorgen's syndrome. We can use lubrication for the dry eyes. Next, we can drink plenty of water for dry mouth. And lastly, we can use moisturizer for dry skin. So now that we are done discussing Jorgen's syndrome, I'll further discuss salivary gland diseases such as xerostomia, sialolithiasis. Xerostomia is defined as dry mouth resulting from reduced or absent saliva flow. Xerostomia is not a disease, but it may be a symptom of various medical conditions, a side effect of irradiation to the head and neck, or a side effect of a wide variety of medications. So xerostomia is a common complaint found often among older adults. Xerostomia occur due to certain health conditions such as diabetes, stroke, and autoimmune diseases such as Jorgen's syndrome or HIV or AIDS. Eating, speaking, and swallowing disorders, sore throat, rough tongue, mouth sore, and mouth infections are the signs and symptoms of xerostomia. So to diagnose a patient with xerostomia, we have to review the medical history of the patient and the medication that the patient is taking. And we need blood tests, imaging scan of your salivary gland, or test that measures how much saliva you produce. And for the treatment, we can recommend products to moisturize your mouth or change medication that cause xerostomia or dry mouth. And for the next disease, we have sialolithiasis or salivary gland stone. Is a benign, non-malignant condition involving the formation of stones within the ducts of major salivary glands of head and neck. This condition predominantly affects individuals 30 to 60 years old and is more often in males. It is caused by dehydration, Jorgen's syndrome, lupus, and autoimmune diseases in which the immune system may attack the salivary glands, gout, and smoking. The causes of sialolithiasis are swelling of the affected salivary glands, which normally occurs with meals, difficulty opening the mouth, difficulty swallowing, pain and swelling usually around the ear or under the jaw. And for diagnostic, we can take up the medical history of the patient and examine the head and neck, including the inside mouth. And for the treatment of sialolithiasis, the treatment depends on where the stone is and how large it is. Therefore, the small stone may push out of the ducts, and you may be able to facilitate this by drinking plenty of water or massaging and applying heat to the area. For the large stone, may be more difficult to remove and sometimes require surgery. Sometimes a thin tube called an endoscope can be inserted into the ducts.
Natunghayan na natin ang kwento ni Pasita at ni Carlo. Natutunan natin na gaano man tayong madapa sa buhay, ang importante ay natuto tayong tumayo at muling lumaban. Ito po si Charot Santon at ito ang He.
Sumpa mo sa akin.
Okay, and back to Daily Dose. Grabe, napaka-informative ng segment natin for today, Noria.
Kaya nga, informative na pinaiyak ka pa. Umiyak ka din ba?
Grabe talaga si Ria, guys. Pero yes, lalo na nung iniwan siya ng asawa niya, di ba? Sabi nga sa kasal, till death do us part.
Kaya kayo, piliin na yung makakasama nyo, ha? Habang buhay. Huwag kayo mahuhulog sa matatamis na salita. Diyos ko.
True. Sabi nga ni John Lloyd sa Biogesic, ingat! So, I hope naman nag-enjoy at may natutunan kayo for this morning's show. Salivary gland.
Maraming salamat kay Dr. Christine Tabeo and our guest, Madam Mimia, for joining us in today's show.
Na mas pinalasa ang ating araw at kaalaman.
Parang salivary glands lang.
Now, let us go to the fun segment of our show.
The game show. Yay! Mag-games na tayo. So, the rules and regulation will be discussed later sa pagbabalik.
Kaya samahan niyo ulit kami sa susunod na kabanata ng show na ito na tiyak na bibigyan kayo ng KKK.
Kasiyahan.
Kaalaman.
At konting kalokohan. Ako si Ria B.
At ako naman si Trixie M. At ito ang
Daily Dose.